Which type of aortic valve is best for you? I'm Dr. Evan Levine, board-certified cardiologist. If you enjoy my videos, like, share, and follow. When we talk about replacing the heart valve, we usually focus on the first few weeks, the recovery, the smaller incision, and getting back to your life. Now, for many of us, that TAVR, transcatheter aortic valve replacement, it's been a life-changing advancement. But as we look towards the future, new data is helping us understand how to choose the right path for every individual. Now, just this week, February 2026, the 6-year and 7-year data from the Evolute low-risk trial was released. Now, there's a lot of good news. Both the TAVR and the traditional surgery, SAVR, are doing, well, a great job of keeping people healthy. At the 7-year mark, the rates of survival and stroke prevention were nearly equal. And that's a big win for medical science. It means we have two very safe options for most of our patients. However, as we look further out, further in time, we're seeing some nuances in how these valves age. While both are safe, the trial showed a trend towards more frequent interventions in that TAVR group. At 7 years, about 9.8% of the TAVR patients required a follow-up procedure, compared to only 6% of the surgical patients. Now, most of this was due to a trend in a leak in the aortic valve we call aortic regurgitation. Now, it may be a small difference, but it may be a really important difference for younger patients. And this is why you want to visit a top aortic valve program where there are experts in TAVR and SAVR who can review each case and help patients decide which aortic valve is best for them. Now, at some centers, and many doctors are aware of this, cardiologists can control the patient, and they may push those patients more likely to get the TAVR. Now, results of this trial suggest we should be taking into account the longevity of the valve, especially after 10 and 15 years. So, for a low-risk patient in the 60s, surgery may be the best one-and-done option because of the durability. For others, TAVR's quick recovery remains the clear priority. It's about lifetime management, not just for the first valve, but for a healthy heart for decades. The goal isn't just to fix the valve. It's to give you your life back. And every patient has a unique story, so make sure you're talking to your heart team about the latest data. I hope that helps.